Madam Deputy Speaker. I'm pleased to have the opportunity to speak in this debate on changes to winter fuel allowance. I, like many of my colleagues on these benches, have been contacted by constituents who are worried about the impact of these changes. But I also bring 25 years of experience of working on public health and older people, latterly as Chief Executive of a national ageing charity. And during this time, I came to understand the impact of cold and damp homes on the health and well-being of older people and the challenges of addressing pensioner poverty. So let's be clear. With those pensioners up and down the country who will be losing their winter fuel payments this winter, where the ultimate responsibility for today's decision lies. Not with the member for Leeds West and Pudsey, but with the member for Godalming and Ash and his party. It turns out they were pursuing a scorched earth policy, the NHS running on empty, costs of housing, asylum seekers spiralling, and hollow promises on capital projects across the country, including in my own constituency. I know that the Chancellor and her colleagues have not taken the decision lightly to means test the winter fuel payments. Hard choices have to be made to put the country's finances back in order. So we know there are many pensioners who are going to miss out, and I worry that they're going to be left in the cold. In my constituency of Shipley, there are 1,160 people who are eligible for pensioner credit but not receiving it. I spoke to a resident in a sheltered housing scheme in Cottingley at the weekend. He didn't know if he was eligible and was not sufficiently mobile to attend a local community centre. So I do ask the Secretary of State to work with colleagues in MHCLG to urge housing associations and local authorities to support their residents to apply for pension credit and other benefits to which they may be entitled. The other group who risk being left in the cold this winter are those whose disabilities, health conditions, or who live in cold and damp accommodation. We know that cold homes can cause and worsen respiratory conditions, cardiovascular disease, poor mental health, dementia and hypothermia. In 2019, the NHS spent at least £2.5 billion per year treating illnesses directly linked to cold, damp and dangerous homes. So pensioners are more likely to be living in poorly insulated homes, leading to a higher risk of fuel poverty. I'm worried about pensioners like Barbara in my constituency, a full-time carer, husband with dementia, having to spend more money because they're at home and because he is ill. So I would also urge my colleagues that given the crisis that the NHS faces, a result directly of the 14 years of funding pressure and cuts that the party opposite, that they work with colleagues in the Department of Health and Social Care to ensure winter planning guidance means the NHS tackles fuel poverty. Thank you.